Hello and welcome. Today we're discussing ear canal foreign bodies, objects that find their way into the ear canal and can cause a range of problems. While not an eye disease, understanding and addressing these issues is crucial for overall health and well-being, and sometimes a seemingly unrelated ear problem can present with symptoms impacting balance or overall well-being, making it important for healthcare professionals to be aware. So, what causes these foreign bodies to enter the ear canal? In children, curiosity and exploration are often the main culprits. Small toys, beads, erasers, food particles, and even insects can be intentionally or unintentionally placed in the ear. In adults, common causes include cotton swabs, hearing aid components, and unfortunately, sometimes insects that wander in while we sleep. Occupational hazards in dusty environments can also contribute. The presence of a foreign body in the ear canal can trigger a cascade of events. Initially, it may simply cause irritation and discomfort. Over time, the object can compress the ear canal lining, leading to inflammation and swelling. This can disrupt the normal self-cleaning mechanisms of the ear, increasing the risk of infection. In some cases, if the object is sharp or forcefully inserted, it can even perforate the eardrum, causing pain, hearing loss, and potential for further complications. Ear canal foreign bodies are quite common, especially in young children. Studies suggest that they account for a significant number of visits to emergency rooms and primary care physicians. While specific statistics vary, it's safe to say that most parents or caregivers will encounter this issue at some point. There isn't a strong gender or racial predisposition. It affects all populations similarly. The symptoms of an ear canal foreign body depend on the size, shape, and location of the object, as well as how long it's been present. Common signs include ear pain, a feeling of fullness in the ear, itching, decreased hearing or muffled sounds, drainage from the ear which may be bloody or pus, like if an infection is present, and in some cases, dizziness, ringing in the ears, tinnitus, or a cough if the object is irritating a nerve. Young children may simply tug at their ear or become unusually fussy. Diagnosis typically involves a careful examination of the ear canal using an otoscope, a handheld instrument with a light and magnifying lens. The doctor will look for the foreign body and assess for any signs of inflammation, infection, or damage to the eardrum. In some cases, especially with uncooperative children, or if the object is difficult to visualize, microscopy or endoscopy with specialized instruments may be required. While there aren't strict classifications or types of ear canal foreign bodies, we can categorize them based on their nature: animate like insects, inanimate like toys or beads, organic like food particles, or inorganic like stones. Additionally, we can differentiate between occlusive foreign bodies that block the ear canal completely and non-occlusive ones that allow some air passage. Treatment focuses on removing the foreign body safely and effectively. The method used depends on the object's size, shape, material, and location. Small, round objects may be flushed out with warm water. Forceps or specialized hooks can be used to grasp and extract larger or irregularly shaped objects. Suction may also be employed. It's crucial that removal is performed by a healthcare professional to avoid further injury. Following removal, antibiotic ear drops may be prescribed if there is evidence of infection. Pain relievers can help manage any discomfort. Under no circumstances should you try to remove the foreign body yourself, especially if it's deeply embedded or causing pain, as this could lead to serious damage. Prevention is key. Keep small objects out of reach of young children. Teach children not to put anything in their ears. Be cautious when using cotton swabs, and avoid inserting them too deeply into the ear canal. Wear earplugs in dusty environments to prevent foreign particles from entering the ear. When using hearing aids, ensure they are properly fitted and maintained to prevent components from breaking off and becoming lodged in the ear. The prognosis for ear canal foreign bodies is generally excellent, provided the object is removed promptly and safely, and any resulting complications, like infections or eardrum perforations, are properly treated. Most patients experience full recovery with no long-term effects. Recent research focuses on improving the techniques and instruments used for foreign body removal, particularly in children, to minimize trauma and anxiety. There's also ongoing work to develop better educational resources for parents and caregivers on prevention strategies.